Hello, my name is Taranjeet Singh Rathore. I am an ICU nurse extern at Kaiser Permanente Antioch. I'm also a semester 6 out of 6 nursing student at the San Jose State University. I have clinical experience as a student nurse in the following branches: medical surgical, telemetry, mother baby, pediatrics, pediatric intensive care, neonatal intensive care, community health, mental health, and medical intensive care. I want to thank the JBI for inviting me to share my commentary on the manuscript by Campos and colleagues titled Immunosuppressive Adherence After Kidney Transplantation in Adult Patients Treated at an Outpatient Clinic, a Better Practice Implementation Project. The World Health Organization describes adherence as a commitment of a patient's behavior related to their healthcare team's guidelines. Adherence is a comprehensive process that depends on socioeconomic status, disease and treatment factors, the patient, the healthcare professionals participating in the care, and the healthcare system. Campos and colleagues focused on assessing the compliance of clinical practice with evidence-based criteria related to practices developed to uplift the adherence of immunosuppressive drugs in adults post-kidney transplant. Additionally, they also focused on identifying individual patient barriers to reaching compliance and designing strategies to overcome the difficulties faced. Medical non-adherence following a kidney transplant is linked to allograft failure and acute cellular and antibody-mediated rejection. Non-adherent patients also have a seven-fold higher risk of graft failure than adherent patients. When compared, the degree of non-adherence in kidney transplant alone is 14% higher than any other solid organ transplantation. Upon approval from the Federal University of the Juiz de Fora, Brazil, the study was conducted at a public-private outpatient renal transplant service in Minas Gerais, Brazil. A patient sample of the adult post-renal transplant was included in outpatient follow-up for at least 15 days. Patients absent in the first outpatient follow-up appointment or readmitted to the hospital during the first 15 post-operative days were excluded. The study also investigated the healthcare team's compliance regarding their practices related to promoting adherence among these patients. Thus, another sample of healthcare professionals, including the doctors, nurses, and nursing techs, were included. Healthcare workers who were on sick leave or vacations were excluded. I like how the study used the JBI practical application of clinical evidence system, PACES, and getting research into practice GRIP feedback tools. Using these tools make the study and interventions easier to be applied in settings all over the world. Following the implementation of printed medicinal education, remote monitoring via telephone, and healthcare workers training, the study yielded 100% efficacy in 38% of the evaluated criteria. One crucial thing to emphasize is the importance of teamwork. When providing education to patients, unfortunately, the hard work done by the nurses, especially the nursing techs and nursing assistants, goes unrecognized, even though the majority of the healthcare team members at outpatient clinics like that utilized in the study have nurses and nurse assistants as the majority of workforce, providing positive reinforcement in ways like recognizing their efforts, promoting incentives to the staff for best adherence rates based on shifts, units are some of the ways that we can motivate the staff to go above and beyond their call of duty in providing education to these patients. Additionally, pamphlets with more visuals are a better educational tool rather than written material. Using visuals can further engage the patients to understand the importance of immunosuppressive therapy after transplant and make adaptations in their life to improve adherence. It is human nature to better remember visuals like photos and video memories rather than long stanzas of medical terminology. Lastly, I would like to suggest further research on providing pre-op studies to these patients months before their procedure and noting how it affects their adherence. I appreciate Campos and colleagues' effort to improve adherence in post-kidney transplant patients. Adherence might seem easy to follow, but there are so many variables that can affect it. Thus, reaching 100% adherence to immunosuppressive drugs following post-renal transplant can be very difficult.